Through an executive order, the governor extended the island's public health emergency for another 30 days, which expires April 2nd. During yesterday's public health press briefing, she finally revealed why the extension was needed.
I believe some of the federal assistance that's been given is not contingent on a public health emergency declaration, but like, for example, the deployment of the National Guard and the paying of the National Guard by the federal government at 100% is under a public health emergency declaration. Having declared a public health emergency uh, gives us the flexibility and the quick response opportunities to access resources to help with the response and to help with the protection of our people.
As we reported, the Guam Freedom Coalition wants the Guam legislature to vote to end the governor's declaration of a public health emergency, which has been in effect for almost 2 years now. A letter was addressed and sent to all senators before the start of February's legislative session. The letter included a petition containing more than 350 signatures and data to support why they feel the governor's executive order restrictions have caused the people of Guam undue and prolonged mental, physical, emotional, and financial hardships. But as DPHSS Interim Chief Medical Officer Dr. Lou Leon Guerrero says, the federal aid the island receives rely on the public health emergency for continued use.
Some of the treatment modalities, the vaccinations, are dependent on having a public health emergency because they're EUA. If we stop the public health emergency, we can still give the Pfizer because it's full authorization, but the other vaccines, the monoclonal antibodies are dependent on us being in a public health emergency.
Should the public health emergency be lifted while Guam continues to fight against COVID, the FEMA contracted nurses and other forms of medical aid provided by the federal government will stop, and that's something the island can't afford. Daniel Perez reporting for KUAM News.